Hello, everybody. I'm very pleased by this opportunity to join you today, albeit virtually. My name is Serena Vulavu. As you can see on the screen, I'm a medical doctor from Kenya. I've currently been in telehealth for close to 2 years now. And at the moment, I am Chief of Operations at Health Consulting, which is again, a telehealth consultancy and provider. And I do many other things here and there. I am on the Kenya Medical Association ICT committee, so these are matters that are close to my heart. And I was very pleased when I received the invite to give a small talk on telehealth in Africa. So it's not, I promise, it's not going to be a major thing. You most likely know more than half of what is currently my presentation already. I wish I was there in person so we could have a more robust discussion, but we'll have to make do. And maybe I'll join you next time. So, going straight into it. So this is just the summary of what I'm going to be discussing. So we do a brief introduction with definitions, go over the development of telehealth programs in Africa, the impact of COVID on telehealth, challenges, opportunities, and a brief conclusion. So as most of us know, I believe, telehealth is just the use of ICT to access both clinical and non-clinical healthcare services remotely, key thing being remotely. And then telemedicine is like a facet of telehealth where it is restricted to clinical services, doctors' consults, provider consults. So and basically any clinical area that you have where you can implement telehealth. So for example, maternal and child health, pharmacy, ophthalmology, dentistry, chronic disease management, psychiatry, provider-to-provider consults, all that can be encapsulated, can be done via telemedicine. And then now for the non-clinical, that now expands the scope to telehealth. It includes provider training in CMEs, having meetings, disease surveillance, public health functionalities, research, and the like, yeah. So I'll just say, for example, I have had the opportunity to work in both telemedicine and telehealth, because at the moment we are a provider for telemedicine services. But before that, I have worked with 2 telehealth firms. So one where I was really, in charge of provider training and so organizing, really organizing how to get, people on board, how to issue training points, how to make sure that the training is relevant, and some of the challenges that I faced in that role, we will get to speak on them while I talk about the challenges facing telehealth in Africa. So this is just a slide with like the basic should I call them models, or the different ways that telehealth is practiced. So you can have synchronous telehealth, which we also know as a virtual clinic visit. So I sit here as the patient, and then you on the other side of the screen are the nurse that's following up on my chronic disease, or the doctor that has been treating me. And I tell you, this is how I'm doing today, this is how I'm feeling today. And then you can have the remote patient monitoring, also called as telecare, or abbreviated as RPM, where I can have devices. So like I have a smartphone, I have maybe a blood pressure cuff, I have I can monitor my blood sugar, I can record my food logs, and then we just log that on, and then the healthcare provider is able to see from the end how I'm doing, how my stats are doing, how my diet is doing, if my diabetes is well controlled, if my hypertension is well controlled, or whatever other condition it is that I have. And then we have provider-to-provider consults. So for example, we call it a medical officer in Kenya. So I general practice basically, and then I need to consult a neurologist. So I sit on a screen like this, and it's a neurologist on the other side. And we can get to have the consult. And then patient portals. So for example, we know what a portal is. So the patient can log in, the provider can log in. Of course, there's different levels of access. So but the patient is able to see X amount of information about their health, and the provider is able to see X information. And if I'm an OBGYN, I can see this patient's history. If I'm a physician, I can see their history. If I'm it's all the information is lumped in one place. Yeah, and then sorry, spazzed out for a second there. And then you can have personal health apps. So many of us have these on our phones installed already. And it just helps you with tracking your basic metrics, health metrics. We know they're not 100% accurate, but it gives a good enough measure of, or a good enough estimate to be able to tell how the going is going, how your health is, what to look out for. And then you can have personal health records. So I'm pretty sure we've heard of several providers that are trying to give the control or the having of the records to the patient, so that patients are not in the dark. Because I've noticed it's a trend that many patients go to hospital and they don't know what's wrong with them. They just go, they're told, here's your medicine, and come back after 2 weeks. So when they have their records, if they need to go to a different facility again, that really works well for them. And then we have the asynchronous. So well, if you compare this against the virtual clinic visits where it's a live call. So the asynchronous one is, for example, I have patient scans and I forward them to a specialist to look at them. So like an MRI, an ECG or whatever. And then the specialist will get back to me once they've had the time to go over that, and then they can give me now a management plan. So I store the information at my point and forward to the specialist or to whoever it is that I'm consulting. And then of course we have mobile health, where you can now have like phone apps that give information to patients. So I'll just go briefly over the development of telehealth programs. And for this, I found a very nifty infographic from this study. So of course, if I was there in person, I'd have asked you, when do you think this trend started, and taken a few suggestions, answers, guesses from the audience. But this study by Dodo, Al-Samarai, and Al-Sway, sorry if I butchered the names, but the development of telemedicine programs in sub-Saharan Africa, progress and associated challenges. So I'll just share that infographic with you guys so you can see. Won't go over it because it starts all the way in 1980. They did a review of, I think, 66 publications with regard to telemedicine. So as early as 1980, we have Ethiopia, Nigeria, Ghana, Gambia establishing telemedicine projects. And then you have Uganda and Kenya jumping in, working with now this St. John's, Canada, launching teleeducation. And then again, you start to see government and foreign alliance implementing telemedicine in Ethiopia. Then they pilot the project, and it has teleeducation, telederm, telepatho, teleradio, teleophthalm, telecardio. Then we move to the west, you see Mali piloting its first telemed project. Then again, you have Rwanda establishing telemedicine centers and video conferencing, Kenya with teleonco, South Africa, first telemedicine system, Mali teleconsult and distance education, Mozambique and Senegal with first teleradiology. 2002, we have South Africa expanding a telemedicine connection to have more cities and rural areas, Mauritania with teleradio and CMEs, Senegal in 2003, distance education for healthcare workers, South Africa with teleradio and telederm, Mozambique with teleradio services, Ghana in 2004 to improve community health care delivery, Burkina Faso with telederm, teleconsulting, teleeducation, South Africa with telederm, Tanzania and Cameroon with maternal and child health implementations of telemedicine mobile clinic network. 2005, we see Nigeria with teleeducation in support of Society for Telemedicine and E-Health, Mauritius, telecardio, teleradio, Mali, teleradio, Ethiopia partnered with India for the telemedicine program. 2007, Nigeria has teleconsults, teleophthalm, telederm, tele-ENT, Mauritania, pilot project on bronchoscopy training, Angola, telepeds, teleconsulting, teletraining between multiple hospitals, Tanzania with Telepeds in 2008. We come to 2009. We have Ghana consultation network with the US, Botswana with oral telemedicine, Telederm, Teleradio, Botswana with teleeducation. 2011, we have Ghana with teleconsult, teleradio, telederm, Uganda video conferencing, Kenya having telemedicine system for teleconsultation. And then 2012, Mauritius sets a plan to implement a national e-health system. Botswana with a teleeducation platform, Cameroon, digital medlab for wound management, Ethiopia, telemed software technologies for telederm, teleradio, telepatho. 2014, we have Botswana coming in, Pan-African network teleeducation, Angola implementing telemedicine network, South Africa now introduces general ethical guidelines for good practice in telemedicine. Ethiopia launches a national e-health policy initiative. Ghana expands its teleeducation, consultation, and surveillance. 2015, Botswana has a project for consultations, telederm, cervical cancer, and family med. Tanzania has a pilot project for radiology, radiation in oncology. Ethiopia, e-maternal healthcare, and extends its existing programs in teleradio, telederm, teleophthalmology, telepathology. Mauritius launched its EMR application and then also launches robotic assisted surgical services. The Gambia expands the use of teleradiology, telederm, and telepatho. Rwanda and Kenya launched teleconsulting. And then in 2016, we have Ethiopia introducing maternal healthcare in Amhara region, so they're spreading it, and then they upgrade its teleradiology, ophthalmology, and telecardiology. Botswana launches teleophthalmology in partnership with local and international agencies. 2017, Burkina Faso launches telesurveillance, and then Rwanda and Burkina Faso introduce teledentistry. 2018, Burkina Faso cloud-based telemonitoring platform to monitor for red flags by midwives. Botswana introduces a teleoncology training program. And then Nigeria introduces teleconsultation with their partners. 2019, Uganda now introduces consultations to health services in rural areas and referral hospitals. Rwanda launches a diabetes self-management system. Zimbabwe launches a new digital health application. And then Ghana upgrades its consultation, teleeducation, and teleophthalm. 2020, where the study ends, Kenya launches a telemed technology center for corona detection. Of course, this is when COVID had hit. Ghana deploys drone delivery of COVID-19 test samples from rural areas. Rwanda launches telerobotics for COVID-19 treatment. So that's just like a very summarized history of telehealth in Africa, and you can see how far we've come in the development of telemedicine, telehealth within the region. So then, since we ended the timeline at COVID-19 and telehealth in Africa, we're going to have a brief discussion on the COVID-induced prominence of telehealth. So in light of everything and looking back in retrospect from the angle of the telehealth industry, you find that that 2020 period provided a great opportunity for the sector due to the restrictions in gathering, restrictions in movement. And, you could just say, like, people were afraid to go to hospitals. People wanted to access treatment, but not be in a place where they could get the disease. Governments were scrambling to find a way to contain crowds and to reach people that are practicing self-isolation at home. And so this really gave a boost to telehealth. So some providers reported up to a 500% increase in demand. I remember I got this figure from a newspaper, not a newspaper, but like an article online. I don't remember which organization it was, but it was a telemedicine provider in Uganda, I believe. So up to 500% increase in demand. I don't have the figures for Kenya, but yes, there was also a great upshoot over here, and I assume that the same was to be seen across the region. And this now pushed for, national implementations of telemedicine, rollouts, even before some of the frameworks and policies that are meant to govern the practice of telehealth and telemedicine were put in place. So, I mean, that's pretty much self-explanatory, I think. But yes, so COVID really boosted the industry, so to speak. COVID helped to break down some of the barriers that telemedicine and telehealth had faced before it came about, because you find that people that were resistant to the practice of it, whether in regulatory spaces, whether at individual spaces, whether as healthcare providers, suddenly were scrambling to use it because it provided better alternatives and better safety, so to speak. With that being said, so we've seen how COVID really pushed it up, and there's a lot of demand, and you can see like there's a lot of funding that's been coming into the continent with regards to telehealth innovations. So what are the challenges facing telehealth in Africa as we speak at the moment? So just building on from our previous slide, so the regulatory framework in many countries, mine included, there's still not a basic or a stable regulatory framework. You'll find that policies regarding data protection, regarding the practice of telemedicine, licensing of, who to give a telemedicine license, should they have a physical premise, should they not, should they have seen the patient once before in person, should they not have done that? All that is still under discussion, and that so that's unclear. There's a bit of uncertainty, and then again now it comes off as very reactive because the policy and the policy frameworks are trying to catch up with the technology instead of providing the environment in which the technology should thrive. Again, the regulatory framework really limits or fails to describe the limits. So for example, if I'm a doctor right now and I'm in Kenya and somebody gets access to to an app, for example, they're able to download an app and seek a consultation, and say they're in Uganda, am I allowed to treat that patient? What happens? Who takes liability in the case of this? If I'm a doctor, general practice at a facility at the moment, and then the nearest specialist, let's say oncologist, is 600 kilometers away, and I have to consult them with regards to my patient who I just got their tests back. It looks like it's a stage 2 malignancy. If the oncologist gives me specifications of treatment for this patient and I apply them, and the patient has poor outcomes, where does the liability fall? So people are still very hesitant to embrace it, when you look at such gaps in the regulatory framework. And then also, just what defines ethics in the practice of telemedicine, things like that. And then the other challenge that we have, that's a great challenge, is the skills gap. So both from the provider and the patients or the clients, because we assume that not everyone would sit in front of a computer or have their smartphone in hand and know what exactly to do, because there are the applications, the user interfaces are very varied, the requirements are very varied. So a lot of training is needed. Let me put it that way. Yeah, a lot of training is needed to make sure that the patient or the client understands what is expected of them, how to use the app to their maximal benefit, and then the provider also needs to know all the steps that are taken. If I press this button, I lose all the history. If I do this, then this happens. If I do this, then the insurance is notified, or some, things like that. So that skills gap needs to be bridged. And then we have concerns about data safety and protection. So we've seen, for example, with the way that COVID came and just pushed everybody to implementation, we had some people using client-grade services. So, using apps like WhatsApp or Skype, Google Chats, what's it called? No, Google Meets. Yeah. So they're not very compliant. They're not fully compliant with some of the health data protection regulations. For example, even as we speak right now in Kenya, they're still establishing the Office of the Data Protection Officer, and now requiring people to start registration, and it's big hullabaloo because now people are helter-skelter trying to figure that out and to be compliant. But because we started before this was in place, but we still have to ensure that patients and client data safety is maintained and upheld. And then there's also questions with data storage and access to data. So if I can access teleconferencing, if I can access patient records on my laptop wherever I go. For example, if I'm in my house and I have a sister who wants to use my laptop and they open it and that's the first screen they meet, that's patient data that's been compromised. So how do we, what some of the challenges that we need to address with regards to that. And then a lot of the interventions are still stuck in pilot phase. So they never really get rolled out beyond the pilot. So you have funds, you find that funds are pretty much scattered across the board. You don't have like set direction. You cite, like, let's say the country started with maternal health, telehealth, and then that seems to be working, but oh my God, there's TB and HIV, so let's pilot something in that direction. And then COVID comes, oh my God, let's pilot something else. So you have all these many pilots running all over the place. And then there's the big question of client satisfaction. So one, we know that many people, especially within the African context, if they behave anything like people, I know from, like from where I come from where my grandma is, they want to see the doctor. They want to be able to sit across the table from the doctor. And even when they sit across the table from the doctor, they want that injection to know that I've been treated and I'm going to be well. So again, so it's not really comparable to the face-to-face services, and we really there's a bit of work that needs to go into changing the narrative to allow them to see that it is just as good, and especially, for the non-urgent cases. And then if you're using the store and forward model, where I get to see patients, and so if I don't have answers to their conditions, I get to take x-rays, MRIs, CT scans, labs, and then forward them to a specialist who then gets back to me with feedback. Then the client feels like, they don't have that instant gratification, because even if I were to refer them on a face-to-face basis, I'd be able to tell them, here, go to this office or go to this hospital. And they'd still feel that, they'd be satisfied that the doctor saw me and sent me here. But in this case, when I tell you, like, you have to wait for a notification, or you have to wait for this and this and this condition to be fulfilled, it becomes a bit, satisfaction is not so great. And then, of course, there's resistance to change. I have seen it with some of the pilots we've tried to roll out in a few counties in the country that are remote, that needed remote access to consultants. So the example I gave earlier of, like, who takes liability if I give a consult and then the patient gets a poor outcome? Is it the doctor that gave the consult, or is it the doctor on the ground with the patient? Those are some of the things that inform the resistance to change. Also, just the skills gap, the usability. And then there's a lot of piecemeal development and implementation. We are aware that there's so many players in the industry at the moment, and each of them is doing something great. Let me add something great, but it's so fragmented. It's really fragmented. So it's a bit hard to see like a clear overall picture, like the overarching, what's the overarching narrative. Yeah, but I believe that, the puzzles are going to start coming together soon, the puzzle pieces. And then there's also the issue of mobile penetration, network access, and cost of data, because a lot of these telehealth solutions do require access to an internet connection and a basic smartphone. So that's a big challenge. And I think we need to, pardon, give me a second. Let me just plug in my laptop. So that gives us, a pretty big challenge to overcome, because again, it's not all the telemedicine providers. It's not squarely on anyone's shoulder. It's more of a governmental thing. And then because that's really infrastructural changes, that's also mobile network provider inputs, so it's a really big multi-sectoral issue that we need to figure out how to sort out if we are to continue pursuing telehealth at the rate at which we are. And then there's inappropriate use of let's say, drug prescriptions. If the doctor is not able to see me in person, I can probably fake symptoms and get prescriptions for drugs that I don't need, including antibiotics. Excuse me. Yeah, and then when I was doing my research, I came across this interesting way of grouping the challenges. Sorry, it's a bit cold. My throat is acting up. So they can be grouped for ease of discussion. So you can have them as organizational, technological, financial, cultural, individual, and legal challenges. Now moving on to the opportunities. So of course, I didn't really cover the advantages of telehealth or telemedicine because I believe that they really speak for themselves and they're pretty loud. However, I might touch on them as I also touch on the opportunities, and I think that they're also a bit overlapping. But one, you have increased access to healthcare. So telehealth gives us the opportunity to really drive penetration of healthcare. We know that the continent suffers from a chronic lack of healthcare workers, healthcare providers, or healthcare facilities, and people have to travel insane distances just to get access to healthcare. And that's at the most basic. If we need specialist care, that's focused on in the cities. So again, if you're in the rural area, you're literally being paid to dust. Now, telehealth and telemedicine comes in because now I can have the provider that's all the way in the capital city on my phone. I can get a referral to them pronto, stat, yeah, at a reduced cost, because again, I've seen across several models that telemedicine, telehealth consultations tend to be cheaper than in-person meetings. That reduces, reduced travel times, reduced cost of travel as well. So it just generally an increased access to healthcare. And then it also provides holistic healthcare, especially if you're able to embrace the model of having like a patient portal where you have centralized health records or health information. So if I'm looking at this patient, if it's my first time seeing this patient, I still have a detailed history. I know what their allergies are. I know what they've been treated for before. It helps me to gain a bigger picture. Is there a psychological aspect to this? I'm able to correlate across all disciplines at whatever time. It also really gives us a great opportunity with infectious disease management. So we've seen this with COVID, where people are now able to monitor their stats at home. Just get a thermometer, and then fill in, a checklist that has whatever symptoms you're looking for. And from a remote desk, you're able to see within this area, these are the number of people, the households that have people in quarantine or in isolation. These are their stats today. This one looks like they're getting better. This one looks like they're getting worse. They might need to be visited or to come into the facility. And then again, chronic disease monitoring that takes on the same model. So patients are able to monitor their stats at home. They're able to see if it's pretty much stable. They don't have to travel all the way to hospital. You can renew a prescription from wherever you are. You're able to tell when things are getting bad. So instead of waiting till the end of the month, you can intervene at the time when you're noticing the difference. Again, it's a big advantage of telehealth, but then it's also a very big opportunity because we know that the African NCD disease burden is now growing, and it's almost getting at par with the infectious diseases, I think, the communicable diseases and the non-communicable diseases. So that's an opportunity for the telehealth sector to explore. That's an opportunity for us to see how to work around such conditions, such issues, and how to make it better, easier, more efficient. And then research and monitoring of trends in healthcare. So I feel like this is such a loaded a loaded point, because when you talk about research, you can do research on telemedicine itself. We've seen there's not so much work done in terms of research on telemedicine acceptance and the modalities, not kickbacks, but pushback against telemedicine, how to make it more appropriate, how to meet market needs. So there's a lot of research that could be done in telehealth itself. And then you can also do research. You can do research with figures, with data that is already present in the telehealth systems. You can monitor trends in healthcare. You can see, okay, at this time, so it's cold, rainy season in Nairobi right now. So, around this time, cases of the flu are really high up. Okay, what does our pharmacy have? Do we have more symptomatic management? Do we have more vitamin C? Do we have more paracetamol for fevers? etc. So that you can monitor trends. You can use them now to map out strategies. You can, there's so much that's loaded within this point as an opportunity within the telehealth system, I believe. And then, of course, innovation and collaboration. There's a lot of interventions out there. There's a lot of apps out there. There's a lot of apps in incubation out there at the moment. There's a lot of people in government that are strategizing and thinking around how best to implement telehealth, what telehealth to do, what priorities meet their countries. So that, the current success of telehealth has really sort of sparked interest in the sector and is inviting more and more minds and collaboration from external sources, internally, governments, private sector. So I think it's really great thing to look at going forward. So thank you. I promised my presentation will be short. I hope I have kept the time that was assigned to me. That's my email if you need to reach out to me. That's my Twitter handle. And I was supposed to have like a slide with references of some of the papers that I went through and the articles to get this. So I just noticed I did not include it, but I will send it to the organizers and they can share it with you if you'd be interested. I'd ask for questions, but you can reach out on Twitter or an email and we can chat. But thank you very much. And enjoy the rest of the summit. Thanks.